name's Ben Sockman, Specialty Care Manager here at Osceola Medical Center. I'm joined once again by Robert Cyberlick. Robert, thanks for joining us.
Yeah, you're welcome. Thanks for having me, Ben.
Absolutely. As many of you know, this is October, which is Bone and Joint Month, and this week we're talking about what type of therapy is best, hot or cold therapies?
Yeah, that's a good question, Ben. This can kind of be a confusing question sometimes because you get different answers depending on who you ask. So for us to answer the question best, I think context matters. And so really there's two things to consider when you're thinking about using heat or ice. So the first thing to think about is whether there's been a recent injury and now you're dealing with some joint pain, or if this is a chronic, kind of long-standing issue that you've been having. If there's been a recent injury, then I would recommend using ice right away. Ice is going to be better at controlling pain and swelling, which is especially important the first few days after an injury as your body kind of goes through the different phases of healing. After that pain and swelling have subsided, feel free to use either heat or ice depending on which one you feel like works best for you. Oftentimes heat will be better with that chronic pain as it kind of warms up the joint and helps to relax the muscles around the joint, and it increases blood flow to that area too. The second thing to consider is what sort of activities you have planned for the day. So if you're planning on just kind of hanging out and getting some rest, then ice will usually do better at decreasing your pain. If you have some activities planned for the day, if you're going out shopping or if you've got some chores around the house, then usually heat will do better at kind of preparing you for that movement.
Is there a certain number of times you should be doing either ice or heat? I think that's a question in our household often is, how many times should I be doing this? How often should I be doing this?
Yeah, so it really depends on the severity of your symptoms, I would say. If you're gonna ice, I would say you probably keep ice on no more than 15 or 20 minutes and probably go a couple hours between sessions too. For heat, again, that's going to depend on what you're doing and how it's working for you. Usually you can leave heat on a little bit longer. You just don't want it to be too hot and directly on your skin. So getting up and moving around every once in a while is going to be good for that too.
So you talked about context, and I think that's extremely important in any healthcare setting. So when you think about, okay, when does this extend to when I should be talking to a specialist or provider? Is it a couple weeks? Is it a week? What would be your suggestion or recommendation for our listeners today?
Yeah, it's always hard to answer because, especially with joint pain, because I think we can easily talk ourselves in or out of going to see somebody about it. When we have joint pain, a lot of times we think that either it's just going to go away on its own or that some amount of joint pain is normal. So I would say if you have had a recent injury and now you're experiencing pain, it'd be a good idea to go talk to your provider. They'll do an interview with you to kind of figure out what's going on and take you through a thorough examination to examine the joint and possibly do an x-ray or some sort of imaging to rule out any sort of structural damage. If this is a long-standing issue, you've got chronic joint pain and now all of a sudden it's getting in the way of doing the things that you want to do throughout the day, that's another good time to go talk to your provider about it, and they can offer you some tips or some recommendations, possibly a referral to either physical therapy or to one of our orthopedic specialists, and they can then talk to you about different treatment options and see which one works best for you.
I like the point of limitations. I know oftentimes we can talk ourselves out of or into joint pain. So when you start to have those limitations, I think it's extremely important to understand that might be the opportunity to reach out to or see somebody for that particular case. So Robert, again, love your expertise, appreciate your time. Thank you for all the listeners today. If you have any questions, please drop them in the comments below, and have a wonderful day.